The number of people addicted to opioids and heroin is rising steadily in northeast Wisconsin, which has doctors turning to an increasingly popular option called Suboxone. Still, it's an opiate, which means it's controversial.
Once you replace the opiate in a controlled way, they're able to focus on their life. They're able to stop all of that behavior, stop the illegal behavior, stop the drug-seeking behavior, focus on psychotherapy, work, school, family life.
Dr. Carolyn Baxter of Prevea Health is one of a select group of doctors certified to prescribe Suboxone. Different from most drug treatments, Suboxone is outpatient. Baxter prescribes the drug and the patient picks it up at his or her local pharmacy.
Typically, patients come in for an evaluation, they get started on the medication, they're only given a day or two of medication initially, and then they're seen back in a few days or a week. Often they do weekly visits.
Monitored by the FDA and DEA, Baxter says she has to prove she's not supplying people suffering from addiction more drugs.
All opiate medications have the potential to be habit forming.
But if done right, Baxter says Suboxone has a high rate of recovery.
It allows time for the brain to heal and for behavior to change and for recovery to really happen.
Deputies in Bernalillo County are worried about the new way heroin users are getting a heroin-like high.
It's a pill meant to help heroin users kick the habit when used correctly. But what's most concerning to investigators is how easy it is to get this drug. Christina Rada is here with a look at Suboxone.
This is Suboxone, little pink pills that help heroin addicts.
It's supposed to, but from what the addicts say, it's just another alternative for heroin.
Undercover officers are seeing something else happening.
There's a lot of people right now out on the streets that are trafficking Suboxones.
It's turning into big business.
Depending on the pharmacy you purchase the medicine from, a Suboxone sublingual film with a dosage of 2 milligrams to half a milligram cost around $166 for a supply of 30 films.
One pill on the streets can go between $25 to $50 a pill.
Those caught selling Suboxone are getting a slap on the wrist.
It's very frustrating as much now as we're seeing it, as much as it's being trafficked. It's very difficult to see it out on the streets, and it's only a misdemeanor crime. Suboxone, from what we understand, is giving the addicts the same feeling, the same high.
This month, Medicaid started paying doctors treating heroin addicts who use Suboxone. Investigators worry this could mean an influx of the drug on the street.
It is the drug at the center of a DEA raid of doctors' offices across the state. Authorities arrested a group of doctors, including one Lafayette doctor, clerical workers, and one attorney for operating a cash-and-carry operation for Suboxone. Franciscan St. Elizabeth Health pharmacist Catherine Pickerel says the drug is prescribed to those coming off an opiate addiction.
Use that to help treat the withdrawal symptoms and help maintain their cravings or prevent their cravings by keeping them on this medication for usually long term.
Pickerel says part of Suboxone's chemistry includes naloxone, a drug used to help reverse the side effects of a drug overdose. She says this helps prevent addiction to the drug.
Littering the side of Central Florida streets, we spotted illegal advertisements for a treatment meant to help break addictions to heroin and pills. The prescription delivers a controlled dose of opioids to help prevent withdrawal. But unlike methadone treatment, which requires patients to go to a clinic daily for a dose, Suboxone strips are prescribed for at-home use.
It's scary to think that we might be recruiting patients who are simply looking to get better.
Suboxone treatment has been around for years, but non-investigates learned changes to the law recently increased the number of patients Suboxone certified doctors could treat with the drug from 100 to 275. And though doctors are encouraged to include therapy with treatment, that's not a requirement.
There's potential for overdose, diversion, and we're not treating the underlying problem.
And without accountability of patients, there's also potential for the Suboxone strips ending up on the black market and addicts going back to their drug of choice.
Hello. Today we're going to be speaking with Dennis Hansen, Executive Director of New Beginnings Detox in Palm Beach County, Florida. Today the subject of our video is Suboxone Detox. Is Suboxone addictive, Dennis?
Suboxone is addictive. It is a partial agonist. In other words, it does not have all the full range of attributes as a full agonist opiate, such as heroin, morphine, or methadone. It is addictive. If you stay on this drug for a long time, you will become dependent on this drug.